Hi everyone, welcome back to my channel. This is a new angle. I cannot figure out where the best place to film in my room is because as other spoonies will know, it's really hard to use your energy on things like cleaning your room. So there's a lot of like clutter and everything, so like there's the desk behind me, which I kind of just like straightened up, so we'll give it a go. Earlier this week, I had an appointment with a regular neurologist for the first time, and she was just fantastic. I mean, like, hit the jackpot there. But you don't know that going into an appointment. Even if you've read their ratings or they're like 5-star ratings from like hundreds of people, like, you don't know, they might not work for you. So today I have compiled what I think are my 10 most important tips for preparing for and having your first appointment with a new provider. So let's get started. I've got my phone here with my video planning Google Doc, super high tech right there. Alright, so tip number 1 is to bring someone close to you that you trust and who can help you advocate for yourself, or even advocate for you based on how the appointment is going. So I find this to be really, really important for me as a person with multiple anxiety disorders, and growing up in the family environment that I did, I didn't get very proficient at advocating for myself. So I have this tendency to, I've been working hard on it, but if I try to tell a doctor something that's going on, they're like, oh yeah, come on, right, don't be an idiot. And then I like try to push back and they shut me down again, then I shut down, which I don't like. But having somebody that with you, like a parent or a grandparent or a friend or whoever you trust, to help advocate for you, they can help you, they can step in and talk to the doc, try to shift things back to the track that you wanted to be on with the doctor. Or sometimes just them like speaking up a little bit can give you the boost again to interrupt the shutdown and get back to advocating for yourself. So along with that ties into tip number 2, which is to make sure that you and this support person that you're going to bring with you talk before the appointment, especially if it's not somebody that you live with or who is always seeing you and your health and everything that's going on. You want to make sure they know why you're going to why you have the appointment, what you're hoping to achieve from the appointment, and so they know best how to help advocate for you. Tip 3 is to bring medical records and or a medical binder if you have something like that. When I'm seeing a new doctor, or when I'm seeing a new doctor and I don't know if they know about the conditions that I have, like Ehlers-Danlos syndrome or something like that, or back when I was trying to get diagnoses on some of these more uncommon things, something that I would do is that I would put together like PDFs and then print them out of, you know, citable information from good sources, like peer-reviewed sources, on the various conditions to have ready if I needed to fight a little bit. I haven't had to use them yet, but I keep them in my binder. For some of them, I keep 2 copies. So like for my Ehlers-Danlos syndrome, I have a copy that I keep in my binder, and I have a copy that I have ready to give to a provider. I also have several extra of the Hypermobile EDS diagnostic criteria checklist. Some other things that it can be really helpful to bring are a list of your medications, and I would say current and past. That just, you know, take a little bit of time to make up a list of why you stopped past medications, because that can be really important and helpful in proceeding with future medications. And also, you know, one of my hallmark symptoms of chronic illness is brain fog and struggling with memory issues. So I found it helpful to sit down at home, you know, with my computer, when there wasn't like a doctor like on me, like the pressure, you know, even if it's not really pressure, but it's like, it's pressure. And went through all of my symptoms, ones that were still happening, ones that used to happen and it stopped, and to go through and again write down dates and information about them to have with me in case I needed to use that. And that way I wouldn't be struggling to come up with it, or I always would get uncomfortable thinking that if I was struggling to remember when a symptom had started, that it would make me seem less believable, I guess. Okay, number 4. So for me, being active and equally involved, if not more so, in my health and treatment plan, it's really important. Not all doctors are like down to have their patients be involved like that, and I think that's, I don't even know what the word is. I don't think that's okay. I think, you know you best, and you know when this stomach pain and this stomach pain and this stomach pain all feel differently, and you know what that has meant, and then like a 4th stomach pain comes in and you're like, don't know what that is. So that's like really important. They can't figure that out for you. Only you can do that. In addition to that, some doctors aren't, or they get upset if you do your own research on things, or, you know, if they're stumped on what's going on, or if they're trying to give up on you and just being like, it's your anxiety, get over it. Then, you know, being able to do your own research and come back to them and present them with those cited sources like I was talking about before. My puppy just came in, and now she's sitting there and she's watching me. Hi, sweet girl. To some doctors, doing research on your own, or bringing in ideas about what a condition, what one of your possible conditions could be, gets you labeled as a hypochondriac. And they're like, yeah, trust the person with the medical degree. We're like, yeah, trust the person living in the body. That was very funny. Yay, sweet girl. Yeah. So if a doctor is going to decide things like that about me based on me doing research, they're not a good fit. Along with that comes tip number 5, which is to have a list of questions ready, like a written down list. Again, brain fog, nerves. You never know what might throw your thought, your stream of thought, your stream of thought off, and make you forget to bring up things that were important to you to bring up. And that would include questions that are specific to why you're going there, like, with the neurologist, it was stuff about migraines. But it can also include things that are like a standard set of questions that you can use to kind of bring up red flags about this provider, whether it is a good match for you or not. Tip number 6. This one's just a short one, but it can be a big deal. Make sure you get to the doctor's office or the medical center or wherever your appointment is with plenty of time to spare, because you don't need time pressure or worrying about being late as another stressor going into an appointment, because these new appointments are stressful. You also don't know if there might be paperwork that they're going to spring on you that they didn't tell you in advance. Like sometimes doctors will mail you or email you new patient paperwork, but some don't. So that way you have time for all of it. Tip number 7. Again, also, I apologize for the noises. That is my puppy keeping her entertained with her rope toy. This again may seem like a small one, but it's a big deal. And that's to trust your gut and trust yourself. If something feels off about a doctor, or you just don't feel like it's a good fit and you don't know why, that's okay. You don't need to know why. It might be helpful in choosing future providers, but all that really matters is that you know that you're not comfortable with the match, and so that's enough to just be like, okay, moving on. I will say that I do know that that's not always an option, depending on where you live, depending on your insurance plan. You may not have much of a choice for other providers. So in that case, I feel like that could be a whole separate video on how to cope with that situation. If you have the ability to find another provider, if you don't feel like it's a good match, then I would jump on that. Okay, this is a big one. Tip number 8. So alongside the questions that you come prepared to the appointment with, that whether that's specific to the reason that you're seeing the provider or whether it's about, trying to see if it's going to be a good fit for you, I would try to be ready to come up with a few questions about things the doctor will say back to you. Like if they'll talk about a possible condition or something. Or ask a question about a test or medication or something like that. I think it really shows... I think it really enforces that you are going to be a part of your treatment plan, and this doctor needs to get on board with it, or if not, then they can say goodbye, if at all possible. And some doctors will just really take the power position. They might think that it's just irrelevant for you to know about why you would be starting this medication because because you're just the patient and they're the doctor. And to that I say no. We'd like to think that doctors only prescribe medications or do tests for a reason, but that's not always true. Sometimes they'll throw medications at you just to get you to become, they'll throw medications at you just to shut you up almost. Again, those are not the good doctors, but, or tests that really don't need to be done. Even just by asking a question or two, you can usually catch on to that, whether it really is necessary. A brief little side note on this topic. When I was in the last psychiatric hospital I was in, which I've talked about many times about how bad it was, one of the nurses called me over to the nurse's station for my afternoon medication, and I went over and I took the meds. It was pills, so I took the water and I took the meds, and then she grabbed my arm and she picked up a syringe and she went to inject something into my arm. I think I yanked my arm out of her hand, and I was like, what is that? You can't just inject things into my body without telling me what it is. that's so violating and so inappropriate. It turned out to be for a TB test, which was fine. I mean, like, I knew that I needed to get that done in order to go into the residential home, but don't inject things into people's bodies without their consent. It's common sense. Okay, tip number 9. Take notes, or have the person accompanying you take notes. You should always get a after-visit summary from the doctor after the appointment, but it's usually just bare minimum stuff like your vitals. This is what we diagnosed. This was your complaint. These are your medications. It doesn't, like, cover any of, like, the meat of the matter of things you might have talked about. In addition, if you make sure to date those notes, it could be good information should, God forbid, something come up later that you would need to, you know, show proof of a doctor telling you something, or in that area. And last of all, tip number 10, I guess it's not really a tip, it's a comment. It can be really hard to, you know, as I've said, to go into a new appointment like this in a stable and calm place. I know for so many of us, we've had a lot of bad experiences in interactions with doctors in some shape or form. It's really hard to be optimistic, and it's really hard not to be so anxious that it's going to turn out like every other appointment that you, like, preemptively shut down before you even meet the doctor. It's kind of confusing advice, but I don't know what the perfect balance is, not by a long shot. I have gone into many appointments, and, you know, the nurse comes and takes your vitals, and you're sitting there waiting for the doctor to come in, and I just want to do nothing more than get up and run the heck out of there. I've come close a few times. It's just like, let's just bail. We don't need to do this. But it is worth it to at least try with the doctor. So I say try to hold on to some optimism and some hope that it could go well. And know the areas that you're vulnerable. So, you know, really take care of yourself leading up to the appointment, and be prepared to really take care of yourself afterwards. Another benefit to having somebody come with you, especially carpooling with them, is that if it's a really bad appointment, you don't have to drive. And if you are alone and it's a really bad appointment and you don't feel comfortable driving, don't drive yet. Like, sit in your car and listen to some fun, badass music and try to get yourself back into a more stable state. So there you have it. This video probably is going to turn out pretty long, but you know, it's a lot of really important information, or at least I think it is. New appointments with providers come up all the time, and it's, to me, that's a lot scarier than running a test or waiting for a test result or something like that, just because of the, you know, traumatic experiences I've had in the past. And I know, sadly, I'm not alone on that. So, see you guys next time.
You also don't know if they might... God.
Specific to the reason your words.